Thank you. Thank you, Hala. Great to see you all in this great venue today. And great to see some familiar faces and some not so familiar faces. I realized yesterday giving the opening address in a conference is actually giving a presentation without giving a presentation, which puts you in a very nice position that you don't have to prepare everything or anything and just come here and play it cool and a bit funny sometimes. It also puts me in a nice position because what I usually do is to speak to NHS stakeholders about my research, which is usually very, very technical because I do research in people with chronic diseases and e-health and telemedicine. And I usually bore people to death with terminology. And today I will bore you to death without terminology, as Hala has given me 20 minutes to give this opening address, which I will not take, trust me. So I would like to say a few things about what we try to achieve today. We're trying to achieve taking stock of what we have done in the past year or so, and some very important keynote speakers have agreed to give a talk, a presentation to you. And what we also, and some PhD students are presenting, and also it is quite important for us to not only to take stock of what we do, but also I think not lose focus of what we're trying to do. So there are people, I can actually see that people in here who are very seasoned researchers and some who are not so seasoned researchers. But it's important for all of us not to lose focus of what we do. And it comes a point in every professional's life that you take a day off, and you say, okay, what do I do? What have I done in the past year? And this happened to me recently, and I took a day off, and I said, what have I done in the past year? And then three things came to mind. The first thing was that I have taken on this new position as head of the PhD school with the Institute for Health Research in this university. And I have been responsible for a total of 50 PhD students, not supervising 50 PhD students. It's impossible. I do have a personal life. But I supervise 12 PhD students, but I'm also responsible for all of them to create a link with other universities, with the industry, with the NHS, develop educational programs for them. So I have taken on this position. And I have been subjected, either wanting or not, to what they do. So they present, they usually come, they ask for my opinion, and then they present in weekly meetings. And what I usually see is that particularly at this level, but also at another level, all my colleagues, sometimes we'll make the mistake to look at our research as a project. And what I usually say to my students is that this is not a project, this is research. And what is the difference between a project and a research? A project could be something that PricewaterhouseCoopers could actually pay you to do, or McKinsey pay you to do, or the NHS pay you to do, and you take the money and you deliver. That's a project. Now, a PhD, for example, and some of you, I can see some faces in here, some familiar faces, we have heard this a lot this year, is that what you're trying to do, and I usually ask my students, so what do you need in order to do research? And everybody says, what is the answer to that? A research money, said somebody. Yes, that's right. And you also need a research question, right? And everybody says, a research question. I said, yes, but in order to have a research question, what do you need? And you usually need what, guys? You need a problem. If you're not solving a problem, there's no reason to spend 4 years of your lives doing research. And once you do the problem, once you understand what the problem is, you have a research question, yes. But then you also need to make an impact. So if you spend 4 years of your lives doing a PhD, or 3-4 years of your lives, getting money, do research, and you don't present an impact to the society, to the patients, to the economy, then I don't think you should spend those 4 years of your life doing that. So one of the things that came to my mind when I took this day off and I was trying to establish what we do is that we do research because there is an issue. Because there is a problem. The problem could be a practical one. It could be, so for example, practice and delivery of healthcare services. It could be a theoretical one, or it could be a policy problem. It doesn't have to be a specific problem that problematizes people. But then you also need the impact. Now, the research is what links the problem with the impact. It's not just a piece of work that you got money to deliver a project. It's not just a piece of work that you got some funding from your government to deliver a project and some outcomes. You need to know what the problem is, what you're solving, and then what the impact is going to be. That was level of understanding number one for me this year. And then one significant event this year was when I was fortunate enough to be on the same table with Duncan Selby, which is some of you who know Public Health England. He's the CEO, the Chief Executive of Public Health England, and I was fortunate enough to be at the same table with him in one of those events, NHS events, and he said, Yannis, I'm not going to take things any further if we don't solve by the end of the year, if we don't solve for people with vulnerable, people who are vulnerable that have needs, if we cannot solve them having a shelter, having a reason to get out of bed every morning, and someone to talk to. And so then the next big highlight for me this year was we don't need complexity in research. We just need simplicity to solve a problem and have an impact. So simple. That's one of the main lessons for me this year. Simple is okay, for as long as you understand what you're solving as a problem and what the impact of your research is going to be. And then that was reinforced by listening to the news one day and realized that it was a group of, you might have heard about this research, a group of researchers from Scotland. They put, and it's quite topical actually because it is about football and everybody keeps talking about the World Cup these days. A group of researchers from Scotland realized that they made an observation. Men in the young age, not all men, but most men, let's accept this as a fact without really making too many questions. But men, as overall, of a young age, they watch football and some women, and then they go to work on Monday and they talk about it. And they talk about it a lot, sometimes more than people need to talk about football, or they can afford to talk about football. And then they talk about football on Monday and Tuesday a lot. And then from Thursday onwards, they start talking about what's going to happen on Saturday and Sunday. So they may get a day off on Wednesday, if you're lucky. Now, some people realized this and said, so if most men do that, in this country at least, that means that they create some very strong memories, and especially around events that they have engaged with. And as Hala said earlier on, if you involve me, it will stay with me. And people then said, so let's see, if we develop a program in which people who used to play football or people who were engaged with football in the past in their lives, they get involved with the program. These people have dementia, so I managed to forget this. So for men who have dementia and they have been previously involved with football, either as players or as followers, as supporters, if we bring them together in one room, what's going to happen? So they did this, which is a very simple observation to make. And you can see, and some people say, you can see the sparkle coming back in their eyes. That means that people start remembering things and they feel damn good about remembering things. Because this is the main thing about dementia. It's not the inability to remember things per se, but it's actually the inability, it's the ability to recognize that you're not able to remember. And that puts you down. So people come into a room much smaller than this, and they sit on a table, and then they start discussing about 1972 best goal or something. And that gives them the way to go back in time to remember, but also feel good about themselves. Is this a very complex kind of design? Of course it isn't. Does this have impact? Of course it does. Is it simple? Yes. Does it solve the problem? I think it does. So, if I had one message for today, it would be, take this day off. Try to see what you do. If you want to be involved in research, in the kind of research that keynote speakers, PhD students and other students are going to present today, please take this day off. See what you do solves the problem, has an impact, and is simple enough to make this impact. And for me, welcome, and it's good to see you, and I'm looking forward to the rest of the speakers.